Hello and welcome. You're watching the Health Talk session by Yashoda Hospitals. If you have a heart condition and your doctor recommends a pacemaker, you probably have few questions on your mind. So what exactly is a pacemaker and how does it function? So let's discuss about all these questions and more in our today's episode. I'm Dr. Lakshmi and let's welcome Dr. Bharat Purohit, interventional cardiologist from Yashoda Hospitals, High Tech City. Welcome, doctor.
Hello, I am Dr. Bharat Purohit, Senior Consultant Cardiologist at Yashoda Hospital, High Tech City.
So to begin with, doctor, what exactly do we mean by a pacemaker and how does it function?
See, heart, as we all know, we know the activity of heart by checking our pulse rate. So we all keep checking it. We have our digital watch, smart watches. They all tell us how many times our heart is beating. So in the heart, we have a specialized tissue which actually makes the heart beat at a particular number of times in a minute. So this specialized tissue is called a pacemaker of the heart. The pacemaker as a device is an artificial thing. So if due to some reason this pacemaker tissue gets damaged, then the number of times the heart will be beating, it becomes slow, and many times we have seen that the heart stops beating and patient may collapse. So this condition we call is a slow heart beating pattern. In that scenario, we have to make the heart beat by implanting an artificial device which is called as a pacemaker device, and that will make the heart beat at a rate of 60 to 90. So in these scenarios where the patient is not able to generate his own heart beating sufficient to meet our need, we implant this artificial device.
So doctor, how do we implant this pacemaker device into one's body?
The device can be implanted in two ways. One is we do a surgery or a small cut down below the clavicle on the right, the left or the right side, and below the skin we try to keep the device, which is basically the battery and the generator, pulse generator, and then from there we have leads like wire like thing which will come through the veins and they will be attached to the heart, different chambers of the heart, and depending on the number of wires which are coming inside, we call them as a single chamber or a dual chamber. But there are certain situations where we are not able to implant them like this, so we can make a cut down below the just above the navel or below the sternal bone and keep it below it also. That is called subxiphoid insertion. So these are the two ways basically and commonly we are doing it. Nowadays we have come up with a very novel therapy where we don't have to do all these cut downs and we can directly implant a very small device through the groin and directly into the heart also. That is called a pacemaker without a lead, so it's called a leadless pacemaker.
So doctor, you've mentioned that it's a surgical procedure. So what are the risk factors or complications associated with this surgery in particular?
It's a surgical procedure, but we don't call it as a major surgery because we are not cutting very deeply into the body. We generally do it under local anesthesia. When you try to insert the needle, you may damage the lung tissue, so some air or some blood may leak out, or many times when you put a pocket in which you are going to keep the pacemaker, if the person's immune system is not good, they may land up in infection of that pocket. And the last but not the least is because the lead is going from here up to the heart, it's a long lead. So many times what we have seen is these leads, they get damaged or they get fractured, but these are some of the important complications which doesn't happen in all the people, but these minor and major complications can happen in around 6 to 10% of patients.
So doctor, the pacemaker or particularly the leadless pacemaker, do you think it's externally visible to anybody else other than the patient, or can they feel it?
So the pacemaker which have leads, they are actually visible as a bulge below the clavicle because we are keeping it just below the skin, and so you can always see those impressions that this is the area where the pacemaker is there. But as the technology has evolved over a period of time, because in the earlier generation when we had the first pacemaker long back in the 50s, we used to have a big battery which the patient used to carry on the trolley. From that era, we have come to a stage we have a small battery like pacemaker which we keep below the skin, and now the latest pacemaker which have come, they are just the size of capsule, so which we can insert directly through the groin and directly put it in the heart, which you will not be able to see also.
Yeah, I think that's an immense progression if we talk about technology in the field of cardiology, doctor. So, post surgery, doctor, what are the precautions that the patient should take in particular?
The most important is the initial days after the surgery, because we have just kept the lead are not still properly fixed to the heart muscles. So at that point of time, we should not be doing unnecessarily stretching of the hand, unnecessarily jerky movement of the hand, and otherwise the leads will get pulled out and there will be dislodgement and we need to replace it. And we should be avoiding too much of fiddling or meddling with the area where the pacemaker has been implanted, and we should be careful with regards to our the way we take bath and with the way we take care of the surgical part. Otherwise there will be infection and hematoma. Once the pacemaker has been completely fixed to our body, then we need to make sure that we try to avoid strong magnetic fields. Yes, nowadays the newer pacemakers are MRI conditional, so when you are exposed to a strong magnetic area, you can still be able to get away with it. But if you are undergoing some surgery or if you are going to undergo MRI, then you need to make sure that you call the person, they will change the mode and still you can go ahead with the MRI in them. And if at all you feel any trouble in terms of your heart beating becoming unusually fast or unusually slow, then you need to think that probably there is some malfunction happening in the pacemaker. So at that point of time, you need to go and check with your doctor and they will assess the pacemaker battery status and then decide what to do next.
So you mean to say that the patient can take up regular activities like exercises and can also travel without worrying about the pacemaker much?
Yes, of course, because pacemaker is not going to affect the day-to-day activity of the person too much, because nowadays the newer pacemaker are rate responsive. So whenever you do more activity, they will make the heart beat at a faster rate. So that's the advantage of the algorithm which is there in the newer pacemaker. So you can do all your exercises, you can do all your regular gym activity and everything without any worry. There is no need to worry with regards to using of a mobile phone, which is a common question which the people ask, that shall we use a mobile phone or not. Yes, you can use a mobile phone. You can switch on, switch off any electrical activity, electrical things which is there in your household. Only thing is, if you get a shock, electrical shock, then you need to come and check the device with the pacemaker guy. Otherwise, no need to worry about it.
So doctor, what are the recent or newer advancements as far as pacemaker is concerned?
We have the technology has evolved from the big pacemaker battery which used to be carried to a tiny small capsule like pacemaker which we call as a leadless pacemaker. And this leadless pacemaker has come with a tremendous advantage, because it reduces the complication rate from the conventional pacemaker. We have been able to cut it down by almost more than 60%. So this newer pacemaker, the leadless one, have that advantage, and you can use it in patient where it will be difficult to put a conventional pacemaker. And because they are cosmetically so good, the hospital stay is just for one day. The pacemaker takes only 20-25 minutes to be implanted, and then the next day patient can go home without any issue. And the another measure is there is something called ICD. So we are coming up with this leadless pacemaker which will be combined with a subcutaneous ICD, so that you can avoid the surgical implantation completely and go ahead with the ICD also. That is, those are the newer things which are coming up with this leadless technology, so that you don't have to worry about leads and implanting the pocket, making the pockets and all those things, and get away with this.
So doctor, implanting the pacemaker, is it a one-time surgery, or are there any conditions or situations where the pacemaker should be replaced?
See, the pacemaker, as I told, has a battery, and these batteries, depending on the pacemaker model and company, the battery life varies from 7 to 12 years. The conventional pacemaker, battery operated pacemaker which are there kept below the skin, they generally last for 7 to 10 years. And the leadless pacemaker, the company claims that these pacemaker can last for at least up to 12 years, and depending on the use also. And if the battery gets depleted, then because you are constantly in check with the company guy, whenever the battery is almost about to finish, we call it as the end of life. At that time you can come to the hospital, we can make a small incision, remove the battery and put one more pacemaker. And if it is a leadless pacemaker, then you can always implant one more small leadless pacemaker, and the company says that you can put at least 3 leadless pacemakers. So if the battery lasts for 12 years, so at least almost 35 years has been taken care of. So this is how we decide the implantation of a second or a third pacemaker in a patient where the life is more and you need more number of pacemakers.
And aside from regular checkups, in what situations should one see a doctor post surgery?
We generally call our patient on 3rd day and 1 week after the procedure to check the wound and also to check whether the pacemaker has been properly fixed or not. And then after 1 month again we will call them, and then subsequently every 6 monthly he will be called for first 1 year, and then from 1 year to 5 year we call them once in 5 years, because at that time it's just a matter of thing. At the end of 5 or 6 years, when we feel that the battery is getting depleted, we call them more frequently every 6 monthly, and when the patient reaches almost at the end of the life, we call them every monthly or once in 2 months also. During the course of this entire period, if a person feels giddiness, or if a person feels that his pulse rate is becoming very low, or if you feel that you are getting some abnormal sensation in the collarbone area or in the diaphragmatic area, then you need to come and meet the doctor. And when you are going through the cinema hall or going through the airport, you can always carry your ID card, so they will not use that pacemaker, the magnetic device over the pacemaker site. So these are the important checklist or important events where you must speak to your doctor before undergoing any other thing.
So before ending this episode, doctor, what message you would like to give to our audience out there?
See, as I said, a pacemaker is a very vital and important machine, and if at all you need a pacemaker, you must consult your doctor and decide which kind of pacemaker you want to implant in your patient. Whether you want to go ahead with a single chamber pacemaker, whether you want to go ahead with a double chamber pacemaker, or whether you want to go ahead with a leadless pacemaker. All the 3 variety of pacemaker are regularly being implanted in our hospital. So if at all you have any doubt or any query which one is the best for my patient, because they all come with their advantage and the cost implications. So we need to decide what is best. It doesn't, just because the leadless pacemaker have come recently doesn't mean that they are best or the other ones are not good. They all have their own indication, where we need to put a leadless, where we need to put a conventional pacemaker, where we need to put a single chamber pacemaker. So it is a whole process which needs to be discussed thoroughly with your doctor, and then you go ahead with the particular type of pacemaker which you want to implant in your patient. So this is a very important exercise. So never hesitate and discuss thoroughly and do the best for your patient.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you all.
So this brings us to the end of this episode. Hope this episode was informative, and thank you all for watching us, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.